Welcome to Mind of a Scientist. It's my great pleasure to introduce registered nurse and nurse practitioner Mia Ludlow. Thank you so much for joining us today.
Milo, your professor asked me to talk to you guys a little bit about healthcare, nursing, and so I was just going to give you my story, some personal anecdotes, as well as I was just thinking right now, maybe a little bit, how do you actually go about going to nursing school and things like that, or other healthcare professions. And there's quite a few out there, right? There's physical therapy, and there's nursing, there's some people start as a medical assistant and move on into nursing, getting their RN, and of course, physicians going to medical school. And so what I was just going to tell you a little bit about what inspired me to go into nursing. And it all started when I first went to college. I was a little uncertain about what I wanted to study. And as I went through my education, I became very interested in health, and in particularly nutrition. And I was a nutrition major for a time, and I was studying food science and social justice issues around food. And so at that point, I thought I wanted to be a nutritionist and do things with food. But then I was very lucky. I got to go to Denmark, and there I studied the healthcare system. And when I was there studying the healthcare system, I studied the nurse midwives there in Denmark. So I went to Denmark and I studied the healthcare system there. And in Denmark, most all the babies are delivered by nurse midwives in the hospital. So I was just fascinated with that. And I thought, that's what I want to do. I want to become a nurse midwife. So I came back to the United States, and I ultimately got my Bachelor's of Science in Nursing at UCLA. And I started working as a registered nurse. My first job was at a big university hospital. It was University of California, Davis. And I worked on a very busy, what it was kind of a post-op, what they called telemetry floor. And telemetry is where they have continuous heart monitoring. So you're at the nurse's station, and there's all these screens, and all the patients are being heart monitored, and then you're helping recover them. And this was a long time ago. This was in the 80s. And at that time, I probably had to take care of 16 patients with a medical assistant who knew a lot more than I did, because I was straight out of school. And you work as a team. So I learned my first job right in there. I was like, boy, this is really teamwork. And I couldn't have done it without the medical assistant, because she was probably in her 60s. I was in my 20s. She traveled all over working. She knew how to take care of people. So that was my first job, and I was there for a while. And then I was fortunate to get another job in another hospital about 9 months later. And that hospital was also in Sacramento, and they delivered the most babies, second to USC in Los Angeles. USC has a huge county hospital in downtown LA, and they deliver lots of babies. And so this other hospital where I worked at delivered a lot of babies. And my path was lucky enough to take me into a 6-week orientation where I was paid, and they showed me how to work in labor and delivery, which is where you work and help take care of moms delivering their babies, and you help take care of them afterwards. You're taking care of the whole family, the baby as well. And then I started working there. But I started working night shift, which just about killed me, because I'm not a night owl. And that's when I thought, I don't want to be a midwife, because if I'm a midwife, I'm going to have to be up all night. So I changed my tune again, and I decided I wanted to just do nurse practitioner, which was I could still take care of women, but I wouldn't have to deliver babies. And so I did that instead. And I went back to school again. Moved back to San Francisco, went to UCSF, and I got my master's in nursing and became a women's health nurse practitioner. So focused on women's health care. And then, so I'm telling you all this just to show how fluid careers can be, and how there's many options, and everyone has their own path, and there's many ways to get to where you want to be and where you want to go. And I was graced with a lot of privilege, and I was very fortunate to be able to get a good education. But I also worked hard, and I had a goal, and that's part of it too. Got to put in the work. And so then I got my master's, and then I ultimately just started working independently as a nurse practitioner. And I really wanted to do that. I love working with physicians, and I like working in collaboration with physicians. But as a nurse in the hospital, I found that I was following orders and doing things that I didn't agree with on a clinical level. And so I wanted to be more independent. And so that is what I did. And so that's part of my career. And I actually went back to school again because I'm completely crazy about 5 years ago. And I got another master's. It was called like a postmaster's. And I became specialized in adult health care. So I could take care of men and women and 13 and older. But now I'm back to working. Now I currently work in a clinic, an outpatient clinic, and I take care of only women again. And I have women, I see 13-year-olds up to one of my oldest patients is 100 years old. She just turned 100. And it's an honor. It's an honor and a privilege. And I'm so lucky to be able to take care of women and hear their stories and have work that I really love. And I hope to keep doing it for a while. I'm almost 60, but I hope to work for another decade or so, and in one capacity or another. I've also volunteered a lot as a nurse and a lot of number of free clinics, one here in San Rafael. There's a free clinic that's no cash. It's just people come in and they get free care for their blood pressure, diabetes, things like that. And so that's little bit about my career. Milo had asked too to say about what were some of the challenges, and like in any career or any work that you do, there's always going to be challenges, right? It's never always, we have good days, we have bad days, or some days our coworkers or our fellow students are driving you crazy or say the wrong thing. And and that's happened throughout my nursing career. And one time I was working at a very busy clinic and I was running behind chronically. I just couldn't keep up with the pace. And I was always like, patients were waiting a half hour, an hour, and oh, it was horrible. And my superior, my boss essentially said, you got to get it together here and start working faster because you can't keep people waiting so long. And so I turned it around and I said, we had a meeting and I thought, oh no, I'm going to be sacked. They're going to fire me. But no, I turned it around. I said, well, what can you do to help me? And how do you keep on time? What can you please help me with this? And that worked. So I didn't lose my job and she really helped me. And so I figured it out. And now I have it figured out after 35 years or so. Now I can keep on time, and I've learned the tricks of communication to move things along when you have someone who, some patients will just talk nonstop and ask about 10 million different things, and you can't allow that to happen when you only have 15, 20 minutes and you have a waiting room full. So that was one challenge. And then when I was very first beginning to think about becoming a nurse, back when I was probably 19 or 20, I was working I had an internship at a little hospital near UC Davis in Davis, California. And I was just totally volunteering, just observing, and I was working in an intensive care unit. And I made a mistake and I told a patient's family about medical issues about the patient, which I shouldn't have done because I was not an employee. And holy moly, I got in big trouble. And the head nurse was a man, and there's lots of male nurses, which is now it's very, there's men, there's women, all kinds of people. Anyone can be a nurse, anyone can be a doctor, obviously. But he looked at me and he said, you get out of here and you never come back. And I was shaking in my boots and I ran out and I was crying and I thought, I'm never going to become a nurse. I'm going to just drop out. But I thought about it, took a walk, and then I came back and I had to address it and apologize. And I continued doing my internship and it all got better. But things like that, there's going to be things that happen. If you really want something, you just got to persevere. So, there's different ways of going about nursing. It's actually not standardized. You can get an associate's degree and become a registered nurse, or you can get your bachelor's in nursing and become a nurse that way. And I would recommend that way, but I think whatever way you can do it and whatever works, financially or time-wise, we all have our own constraints in our lives to go for it and do it. And even starting, a lot of people they'll get their training as an EMT, an emergency medical tech, and maybe do that, work for an ambulance company, or, if you're interested, volunteering in the hospital, just putting yourself out there, getting as much experience and really if you think you want to do that, will really find opportunities to volunteer and immerse yourself in the environment of healthcare to see if that truly is what you want to do. I think a lot of people want to go into nursing too. It's because they think, oh, it's a good job, which it is a good job, and you can make a very good salary and have good benefits. But it's really hard work, and it's hard work on an emotional level and a physical level. So you really have to have really know what you're getting into. You have to have your eyes wide open, right? And not just doing it for the pocketbook, although some people maybe do that. The other thing what nursing is, which is I find really appealing, is it's a scientific study. You have to know about the pathophysiology of disease, and you need to know your math to a certain level with calculating IV rates and things like that. It's fairly simple in that respect, but you do need to know the biology and the science and understand that. But it's also very much an art, and it's an art, and like you're going to be faced with super difficult situation, and you've got that science down, you know how to start the perfect IV and draw blood gases, and you're a great ICU nurse, but you also have to be able to know how you communicate with your patients and with the family members and with the physicians, and it's sort of a dance on how you work all of that, and there's not just one way to do that. So that's kind of more the art of it. And I would say too, recently for me, what's been very challenging, which probably would not be a challenge for all you students, but in the last 5 years, I've had to learn about electronic medical records. So I in the old days, which wasn't very long ago, we did all paper charts. So we literally hand wrote all our notes and recorded everything by hand, or you could dictate, and a dictate machine would write out your notes for you. That was another way of doing it. But now everything's on the computer, and they're called electronic medical records, and different hospitals have different electronic medical records. So you have to, that's part of the learning curve, and they're constantly changing and evolving. And so there is a lot of time now that's spent recording everything you do on the computer. But there's templates and things and ways to make it go quicker, and you learn that as well. But that's been a big challenge for me recently, is learning different computer programs depending on where I've been working. But it's also been fun. It's also been a fun thing. And I've also had to learn how to type much faster because I never took typing in high school. But I've gotten much better at that. And some people will go get a bachelor's and then go on to nursing school. There are programs in college where you can just do nursing directly, where there are some different schools that can do that. But a lot of people do the undergraduate and then they go on and get their nursing. And then I did have a few tips. If you guys want to read about some books, there's a great author, maybe you've heard of him, Atul Gawande. And he's a surgeon. He does surgery on endocrine glands and things like on the thyroid and parathyroid, that kind of thing. But he's also a very good writer, and he's written about his time in the operating room, about medical school, and about dying, and how to talk to our grandparents and loved ones about dying if they're at a point of their life where they have not as much time to live. And then he's also on Biden's task force, COVID-19's task force. So he's a pretty cool guy. And then in terms of some fun shows, a good one's called The Midwife. And that's actually quite accurate in terms of its recording of births and things. It takes place in East London, I believe in the 40s. And so it shows of these childbirth before they had before they knew a lot of treatment, about how to treat infections and different things like that.
Well, I think we could take a few questions. Students, if you could put your questions in the chat. And and while we're waiting for the student questions, could you tell us about one of your favorite classes through your education?
Oh, yeah. So most recently, when I did the more recent program I told you about for adult health, I took a class on pathophysiology, and it just went into great depth into the cardiovascular system, basically the heart and circulation, and on the pulmonary, on breathing, on all the different organs and systems in our body and how they interrelate. And it got really into detail about the chemistry and all that. And then we use that to learn how to treat, for example, congestive heart failure or heart failure, which is essentially when your heart has to work really hard to pump, and it gets thicker and thicker as a muscle, and so it doesn't work as well. And so we would do these elaborate case studies on how to treat and take care of people with, for example, congestive heart failure. And then there were a number of other clinical cases where we'd use this pathophysiology and the science to learn how to understand the kind of medications we used, why you'd use a medication, not just to give the pill, but how the medication actually worked. And so I really love that. I love the science and the biology, and I'm constantly reading new things about it. And that's one thing about nursing or medicine, any kind of work within the healthcare field, respiratory therapy, there's different professions, is you just constantly are learning. You will not get bored because things are constantly evolving and changing, and there's so much to read and so much to learn, and there's constantly new journals and articles, and there's constant research, and careers can evolve too. So like if you did start in the hospital and you just thought, this isn't for me, well, you can work in a clinic, you can work in a school, you can work going to patients' homes, doing public health. So there's just a lot of different career options out there, and a lot of different things that you can do.
Carrie asks, what would you want new nurses or nursing students to know before beginning their career?
What would you want new nurses? I would say that to always ask questions. You definitely, when you're new, you're learning, and you really are going to learn almost everything you need to know that first couple years that you're on the floor or when you're out working. And you have to recognize that. So you ask for help. And if you don't know something, or if you don't understand something, or if something doesn't feel right, you get help. You never try to wing it. I mean, sometimes you have to wing it, right? But if you know something's not, you get help. You work as a team. That's the most important thing, is working as a team, listening to your gut, and asking for help and getting the support you need so you don't burn out or fail or make a big mistake.
Mm-hmm. Stefan asks, how have nursing practices evolved during the years, and what was the most drastic change?
Well, when I first started, they wanted us to wear a nursing cap at graduation. So we don't have to wear those nursing caps anymore. But nursing has become, I think nurses have become a lot more autonomous. There's a lot more accountability and a lot more work. They're unionized. Actually, when I started working there, we didn't have a union. The union was just beginning. So I didn't really have the representation that a lot of workers want and deserve to, because hospitals are a big business and they can burn you out if you're not careful. So I think having the union, having the representation, and just making it a lot more, I think there's a lot more respect for nurses, and it's definitely male and female. I think it's all, definitely, I think nursing is quite a very diverse field in all respects.
Mm-hmm.
But it definitely, you need it, it's also a place of privilege because you got to be able to pay for the school. And so that's the social equity issues come down to providing education and those opportunities for everybody of all colors and backgrounds and everything.
Mm-hmm. Mateo asks, do you ever regret not getting a PhD? And how much harder is it to get a PhD over a master's or a bachelor's?
So I don't regret it because I don't really want to teach or just do research. I guess, sometimes I actually do think about that now, Mateo. I make doing that now because it'd be a good time for me because I could sort of do that as opposed to working in the clinic, which is very physically challenging and hard for me. I get so tired from it. But What they do have in nursing and what they're trying to standardize in nursing and for nurse practitioner, it's a doctorate program. It's not so much a PhD, but they call it a nursing doctorate, and it's another year or two, and then all the nurse practitioners would be standardized. And you do have to do some research during that program. So that's something that is in the works now, and a lot of nurse practitioners are getting that. But PhD, it's very much geared toward research and teaching. And I've taught nursing in college to college students, and I love doing that. But I don't want to do it all the time. I did that for a couple of years.
Mhm. Sophia asks, do you have to take classes as part of your work to learn about new medical technology or medicine?
No, I do have continuing education that we have to do. I have to do at least 30 hours every 2 years. I have to keep up my continuing education and show that. And then I have to submit it to the Board of Registered Nursing through the state of California. And then I have to do education to keep my prescription authority so I can continue to prescribe medications. Um, the medical technology classes, if you work in a class, if you work in a hospital, they'll have orientation where they teach you that as part of the job training, but it's not required. And a lot of it's really learned on the job. It's learned while you do it. And it's part of the learning curve.
Mhm, mhm.
Yeah.
Stefan asks, what was the most stressful situation you were placed in? Could be a life-saving situation or just a long day. And how did you stay on track amidst the chaos?
Oh, yeah, that's tough. There's a lot of those days. I think when I look back at when I was working in a hospital as a brand new nurse, Stefan, the Doomslayer, I I that was really sink or swim because I had some really critically ill people and demanding patients, and I was brand new. But you just keep putting one foot in front of the other. And then there was times when you shed a few tears, or you walk outside and you scream, and you come back in and you get it together and you do it. And then just yesterday, I had a patient who I walked in and wouldn't stop crying they gave me an hour with her because she was so upset. So I had this completely stressed out person who I had to deal with, and we just worked it out. So a lot of listening and a lot of acknowledging, and also but I think that's just it. You just get through it. And then a lot of self-care too, because it is common with a lot of healthcare providers, particularly now during COVID and the hard year we've had, is a lot of people will resort to substance use or alcohol. So it's real important to make sure you have the self-care and take care of yourself in a healthy way so that you can continue doing your job. And so you got to take care of yourself in healthcare because it can burn you out. So you got to do your exercise and get enough sleep and all those things that we all know we need to do to stay healthy and eat well, right? And have things that are fun, hobbies, things that are enjoyable.
Mhm. Carrie asks, what are your views on universal healthcare?
I think we should have universal health care. It's private insurance. It's a travesty. People can't get tests that they need. They can't get medications they need. And I feel like everyone has a right to health care. Absolutely. And I'm a proponent of it.
Mhm. And Rosalie asks, what are the most rewarding parts of your job?
Just like I'm just so honored I get to take care of it to these amazing human beings, and I hear their stories, and they're often so appreciative of my time and what I've done for them. And it's just heartwarming. And I also enjoy the challenges and the clinical challenges, or some of the actual procedures that I have to do that are challenging and new, and learning new sort of test skills still. I'm always still learning, but it's mostly the human interaction and the connection with these people. It's quite amazing. And people are very vulnerable when they come to see their doctor sometimes, not always, but sometimes, and they will often share things that maybe they've never told anybody else. And they're sharing their vulnerabilities, their stories, good or bad things that have happened to them.
Mhm.
So, yeah.
And Rosalie is wondering what types of equity issues you see in your line of work.
Well, that's a really, I work in a private clinic, and so almost everyone we see is insured. And I live in Marin County, which is mostly white. I don't work at the community clinic. There's a big community clinic, Marin Community Clinic, which is more Medi-Cal and pay as you will. And that's definitely has a lot more diversity and equitable care. So again, I think it comes down to universal health care. And I feel like the physician I work for has very socially justice minded and would never deny a patient based on anything. She won't see them if they don't have insurance, though. So it's more of the finance thing, which I think ends up being an equality thing too. So, but I think it's real important to reach out to different communities, brown and black people, and recruit more nursing and more doctors and healthcare providers, particularly physicians and nurses. That's something that needs to happen. And I'd like to get involved in that if I could in some way. And I probably could. I think I'm just thinking now that's something that would be good for me to do, because I've been so lucky to enjoy my work.
Mhm. Well, it's just so cool to hear your story and learn more about this field.